Free money. Programs that give residents cash to help with basic needs are cropping up nationwide. In an era where economic uncertainty continues to challenge many households, several cities have launched guaranteed income programs aimed at providing financial stability to those in need. These programs are designed to offer direct, unconditional cash transfers, allowing recipients to cover essential expenses and improve their quality of life. Now, here are a look at three noteworthy guaranteed income initiatives that are making a significant impact across the country. Number one, the Stockton Economic Empowerment Demonstration, SEED-C. It's available to residents in Stockton, California. Launched in 2019, the Stockton Economic Empowerment Demonstration is one of the first major guaranteed income experiments in the United States. The program provides $500 monthly payments to 125 randomly selected low-income residents, and this payment lasts for 24 months. The initiative, headed by the Economic Security Project, aims to evaluate the effects of guaranteed income on a recipient's financial stability, their mental health, and their overall well-being. Now, preliminary results from SEED have shown positive outcomes, including improved financial security, increased employment rates, and enhanced mental health among the participants. The program has garnered national attention and serves as a model for other cities who happen to be also exploring similar measures. And then number two, the Magnolia Mothers Trust, available to residents of Jackson, Mississippi. The Magnolia Mothers Trust focuses on supporting low-income Black mothers in Jackson, Mississippi, with monthly payments of $1,000. Launched in 2020 by the nonprofit organization Springboard to Opportunities, this program aims to address economic disparities and provide a financial cushion for single mothers who often face significant barriers to economic stability. The Magnolia Mothers Trust has demonstrated notable improvements in the recipient's ability to meet basic needs, reduce debt, and invest in their children's education. The program has been praised for its targeted approach and its positive effect on the participants' financial and emotional well-being. Gosh, you notice how financial well-being or financial increase can be tied to emotional well-being? Okay, maybe they're waking up to this, because I think most of us out here as working people, we recognize that. Maybe somebody will wake up the politicians. And then there is number three, the Comptonpledge, available to residents of Compton, California. The Comptonpledge, initiated in 2021, is a local guaranteed income program providing $1,000 monthly payments to 800 low-income residents of Compton, California. Funded through a combination of private donations and city funds, the program is managed by the nonprofit organization Fund for Guaranteed Income. Early reports from the Comptonpledge indicate significant improvements in the recipient's financial stability and quality of life. Participants have used the funds to cover rent, utilities, and other essential expenses. The program is also being closely studied for its potential to influence policy changes and inspire similar initiatives in other cities. Now, looking ahead, these programs represent a growing movement towards economic justice and financial stability. As they continue to evolve and expand, they provide valuable insights into the effectiveness of guaranteed income as a tool for reducing poverty and supporting community well-being. Now, there are currently more than 100 programs in the nation. Local leaders, advocates, and policymakers are closely monitoring these initiatives. They're eager to learn from their successes and challenges. Now, the hope is that these programs will pave the way for broader adoption and inspire a future where guaranteed income is a key component of social safety nets. If neither of these initiatives are where you live, then here are a few resources where you can research and find an initiative near you. The Stanford Basic Income Lab and the Center for Guaranteed Income Research has a dashboard that lists guaranteed income pilots across the country. The link is below here on my YouTube channel. Now, you can also reach out to organizations that do anti-poverty work, such as the Fund for Guaranteed Income, for information about projects that they're involved in. Now, this information is also shared in their newsletter, so you want to sign up for that. Now, reach out in your city to see if your city is represented at the Mayors for a Guaranteed Income. This is a network of city leaders who are putting programs in place. All of these links will be shared here on my YouTube channel. So check it out, because any increase in finances, again, the key component is not only were people paying their bills, but it also increased their emotional well-being. Dr. Anna Irwin is a board-certified physician in anesthesiology and interventional pain management from Clearway Pain Solutions located in Bethesda, Maryland. Dr. Irwin embraces a multimodal approach to pain management, addressing the physiological, physical, and psychological components of pain. She uses state-of-the-art technology for minimally invasive treatment, including the mild procedure to treat chronic low back pain caused by lumbar spinal stenosis, also known as LSS. The mild procedure addresses a major root cause of LSS by removing excess tissue to restore space in the spinal canal. And great news, because it's nationally covered by Medicare. The mild procedure also takes less than an hour and can be performed through a single tiny incision, smaller than the size of a baby aspirin. Dr. Irwin is here with us today to share about this option that you can utilize to treat your chronic low back pain. Welcome, Dr. Irwin.
Thank you. Thank you so much for having me.
So tell us more about this mild procedure. I've never heard about it.
So the mild procedure stands for minimally invasive lumbar decompression. And basically, it is used to treat a component of spinal stenosis where there's hypertrophy of a ligament that's in your back. What a lot of people don't know is lumbar stenosis is very common. 2 million people can have it in the United States. And often you'll notice people in the grocery store when they're leaning forward. So when they're walking, they'll have back pain and pain that goes down their leg. We call this neurogenic claudication when it's caused by lumbar stenosis. And the mild is going to address that component of lumbar stenosis.
So is that the point where you know, like if you're constantly in pain, like at what point, what are some of the symptoms where you know that I should probably seek surgery? I guess, is this called surgery?
No, so we consider this a minimally invasive procedure. We have, wonderful surgical colleagues and they, perform surgery. This has the safety profile of an epidural. So if a patient comes to our office, so if you're having more bad days than good, you're feeling, you can't get your daily activities done, you're really struggling to get through your day, you should seek out a pain management doctor. I can't tell you how many times a day I hear that people are like, we didn't even know you existed, or that this type of doctor even existed. And so there's a whole range of therapies that we, will do a formal evaluation, look at your imaging. We start with conservative measures, all the basics, physical therapy, medications, epidurals, injections, and we move along this algorithm and get to the mild procedure. And the mild procedure does a great job. As you said, it's performed very quickly, often in 30 minutes or less, and can be done under local anesthesia or light sedation.
Okay, so is this an issue like lower back pain? Is it an issue primarily as we age? Is it caused from a fall throughout the years? Is it just a lot of different factors?
Primarily, this is going to be a disease that we see later on through life, so with aging, because what happens is that ligament is almost like a rubber band, and it thickens over time and develops like calcium deposits, and it's stiffer and kind of compresses those nerves. So primarily, this is a disease that we will see in older people because it takes time for that calcification to develop, and so kind of progresses as we age.
So it's interesting that you called it a disease. I thought maybe it was considered an injury, but it is a developing disease.
Correct. So I would typically relate to this as, changes that happen throughout aging. I wouldn't necessarily define it as related to an injury. It's more something that happens and develops over time, just in natural response to our body.
So you mentioned physical therapy. So is it where a patient comes to you, they've been in pain for many years, and you run a bunch of different tests and you take them through, is it a treatment? So it's physical therapy, it could be I guess a slew of different treatments before they actually get to the actual mild procedure. And do you have other procedures if that person doesn't qualify for the mild?
Correct. Yep. So we always, when you come in for to any pain doctor, they're going to do this evaluation, and they're going to do a physical exam and a history. And we always start with conservative measures. So, if you've never tried physical therapy, because all of that stuff is important to strengthen your core, to kind of keep things in place. And then based on your symptoms, we kind of decide what treatment algorithm would be appropriate. Typically, if we look at back pain in two different ways, there's axial back pain, which is just back pain, and then there's radicular, meaning it goes down the legs. And what the mild is really going to treat is this back pain and pain down the legs that is noticeable with walking. The big term for that is called neurogenic claudication. And so this aching in your legs when you start walking that relieves itself with rest. And when you sit forward and kind of bend over, the symptoms resolve because that stenosis kind of opens up. And so that type of patient is potentially a candidate for the mild. We also will get MRIs and we'll measure how big the ligament is to kind of correlate your symptoms, your MRI findings to see if you would be a candidate for the procedure.
How long has the mild procedure been available?
So mild's been around about 7 or 8 years, and about 1 million people have been treated with this therapy.
Okay, and it's specific to a pain management doctor who performs it. It's not something that's available in any hospital.
There are certain pain doctors that are on staff in hospitals. So, but typically this is performed by a interventional pain management doctor. And so your physician, your family doctor, your orthopedist will consult with a pain doctor, and then we can decide the next treatment options.
So before the mild procedure was around, what were people doing? Just living with this pain? Because I actually have my fiance's well, aunt has major pain. Like she hasn't been able to walk without pain for many years. So it sounds like it was probably something she could have considered many years ago. Is it just something people were just dealing with, just taking pain medicine and covering up
Correct.
the pain?
Yeah, and so a lot of people have been, what we would always do in the past is an epidural. So we would basically do a steroid shot into the back around those nerves that are being pinched by the stenosis, and we would see if their pain gets better. Typically they'll give short-term relief, a couple months, and then the pain would start to resolve. Sometimes they wouldn't work. Epidurals are still a great option, and oftentimes things that we try first. But mild, provides a longer term solution for this.
Wow. And a better quality of life overall, probably.
Yeah, so our goal is, pain management is kind of twofold. So we're definitely looking to control your symptoms, but improvement in functionality is very important as well. So if you have no pain, but you're not out walking, that's a significant burden, so we want you to have reduction in symptoms in pain, but also improvement in functionality. So those are kind of the outcomes that we're looking at with any procedure, specifically the mild.
Okay. Is there anything else that you want to share about the mild procedure that we haven't spoke about?
I think one of the things that's great about the mild procedure is its safety profile. So very safe. It's a small incision. The incision's smaller than the size of an aspirin. You don't have a stitch or anything. It's you'll be up and about the next day without any problems. So
And when you say incision, is that in the spine?
So just through the skin. So the incision goes through the skin. It's very small, and everything's performed through what we call a trocar. And you'll have just a tiny steri strip and a Band-Aid over the area. Should have very minimal bleeding or anything like that.
Do you go under?
Under anesthesia?
Yes.
So often we'll do it under sedation. If people prefer that, we can do it under local anesthesia. So it can be done under a variety of different sedation levels, from just local anesthesia to something deeper, depending on what the patient preference is and what we think your ability to tolerate the procedure.
Yeah, I'm a chicken.
You're laying on your stomach for about, 20 to 30 minutes. So that can also play a factor into what kind of sedation needs are, just because laying there can be challenging.
Okay.
One of the things that I would like to also bring up about the mild procedure is that it will continue to improve over time. So the data shows that 1/3 of patients get better in the first week, 1/3 of patients get better in the first month, and then 1/3 of patients in the first 3 months. So it can take time for you to fully notice the effects and the benefits of the mild.
Okay. And I know Medicare covers it. So the basic Medicare will cover 80% of it, unless someone has supplemental as far as the 20%. Or is it maybe because this is pain, maybe Medicare covers all of it? I don't know how that might.
That would be a great question for the team. I haven't had anyone not or complain about it. So I think it's fully covered through everything.
Okay. And
I don't know the answer on that.
And what about regular insurance for those who are not on Medicare yet?
Yeah, regular insurance, it's definitely a little bit more limited. We always will try and authorize it as it comes up. However, as we talked about earlier, it's mostly in a population that's aging. So Medicare is definitely the primary focus that we're seeing this for.
Very interesting. How would a potential patient reach you? And for those who are not in the Maryland area, or the DMV area, I guess I should say, which is, for those who don't know, DC, Virginia, and Maryland. How would someone reach you who's in the area, who's interested in learning more about the mild procedure, and who are those who are out of the area but will want to find someone who does the procedure in their area?
Perfect. So Clearway is a big corporation, and we have offices all over. And so if you go on our website, you can find myself, Anna Irwin. or other Clearway offices where a lot of our providers offer the mild procedure. If you're not in the area, there is a website. So if you Google mild procedure, you'll find a list of doctors in your area that are very proficient in mild.
Okay, perfect. Thank you so much for joining us, Dr. Irwin.
My pleasure. Thanks for having me.